Hello, this is part two of my open heart surgery story, and haven't moved at all. I'm 10 seconds after I ended the first video, uh, but I want to recap something I said in the first video, or a few things I said, and to offer some additional explanation. Uh, again, I mentioned in the first video that for about 2 years, maybe 2.5 years, I had known that I had a likelihood or a potentiality for having some relatively severe, uh, uh, arterial disease, vascular disease, and one of the reasons that it was believed likely that this was actually exacerbated by me getting COVID is because the presentation of my calcium was not consistent with organic accumulation. Um, Typically, the calcium, when it accumulates organically over a number of years, it is what they call diffuse, I believe, uh, throughout the arteries around the heart and apparently extending somewhat outward from the heart. Mine was not diffuse at all. It was, concentrated in certain areas. And the arteries that are typically impacted most heavily in people that have traditional and organic cardiac artery disease. Uh, uh, I had one artery that was not affected at all. My calcium score was zero, and that particular artery is one that would normally be the first one to be affected in a typical patient, apparently. So the doctors are looking at me as somebody that, and they told me they're going to follow me for probably the next 10 years, just to see how things turn out. And there's additional research that's being done around the United States, although it's not really publicized, but it's looking at uh, the impact that COVID had on coronary artery disease and uh, either exacerbating existing disease or just laying fertile ground, if you will, uh, for new disease. So anyway, that's neither here nor there. I had what I had, and it is what it is. Uh, but anyway, in the last video, I talked about the fact that for about 2.5 years I had traveled extensively, and I had traveled extensively. Uh, Nothing during my experiences in most of the world outside the U.S. and certainly in Asia, uh, you know, most countries they do a lot more walking than we do here. And over the last 2.5 years, I've walked, I've traveled extensively. In 2023, I probably only spent about 65 days in the U.S. Uh, and I don't know uh, collectively what my average mileage per day would be, but I can tell you in instances like just in April when I was in China, I was walking about 12 miles a day and had no issues walking 12 miles a day. Um, and, when I'm in Thailand, because I tend to stay pretty much the same place whenever I'm in Thailand, my average walking per day is going to be somewhere between 5 and 7.5 miles, which is a significant amount of walking. And also Thailand is pretty warm year round. Uh, did not have any problem walking. I was carrying. I have a backpack computer case that is always too heavy. It's probably pushing 40 pounds. So I mean, I'm walking, um, miles per day, carrying basically a rucksack around with me, and was not short of breath. Was not having, had no problems to speak of. So again, I had reasons for kind of in my own mind telling myself that there had been a mistake in my calcium score when I had it done, and I really tried not to think about the downside of this any more than I had to. Uh, but anyway, now we're into part two now. So in the last video, if you'll recall, I was sent home on a Tuesday, which was my fourth day post-op. Uh, I have no qualified reason for saying this, but if I had been given a choice, I would have stayed at least one more day at the hospital. Don't have any reason for it at all. I mean, I was able to go home and function just fine. I was fully ambulatory, as they say. Um, there was nothing that I reasonably needed to do at home that I couldn't do by myself. Uh, that would include, going to the bathroom, bathing, showering, cooking a meal, things of that nature. I was stable. I was in full control of my body. Um, I was not having any kind of significant fluctuations in blood pressure. Uh, nothing that made me concerned about passing out or falling or any of those things. Uh, but now, with that said, and I meant to put this at the end of the first video, but I want to really state it now very emphatically at the beginning of the second video. I'm single. Uh, I live by myself, have no wife, no kids, never have had a wife, never have had kids. In the world we live in today, we don't know our neighbors very much. And I've only been in the neighborhood that I'm in now since 2020. And while I've had good neighbors where I'm in the area where I'm living, in the neighborhood where I'm living, uh, one of those, a friend of mine well, he was a neighbor who I became good friends with. He passed away a year ago suddenly from just end-stage liver disease, liver cancer. And I've had no reason to be where I'm at other than just I was just kind of moving around so much. It worked fine for me. I just stayed where I was, but I didn't have a relationship with any of my neighbors around me. Um, but absolutely positively, I would say for 5 to 7 days, if after you come home, if you're in the same position I'm in, where you do not have family members or neighbors, uh, and you don't need neighbors that are next door. You need neighbors that will come over and literally stay in your house with you 24 hours a day for 5 to 7 days. Uh, Now, it may seem like a big leap from where I was a second ago, where I said, hey, I was able to get around and do everything just fine. Um, that's true. So the person you need to stay with you does not need to be a nurse, unless you're in far worse condition, in which case you probably wouldn't be home anyway. They probably would have sent you to a rehab center. But you don't need a nurse. You don't even need like a certified nursing assistant. So you don't need to call a home care place or anything like that. What you need to do is if you need a competent individual, uh, I would say a high school kid would be just fine. You need someone who's willing to come over. You feed them. You let them play video games on your big screen. Have them stay over. Uh, but you need somebody with you just in case. I had, and I'll explain in a second, but I had the just in case situation happen. And I can't overstate to you that I have used up every bit of luck uh, that I'll ever have in this lifetime. Uh, but you absolutely positively must have, if you're single, living by yourself, and you don't have anyone who is already in the household, you need to find someone and get them into that house, and they need to be there for 5 to 7 days. They don't need to be nurses. They don't need to. You don't need somebody who's bigger than you so they can pick you up or bathe you. You can do all that yourself, or they would not have sent you home. But you need somebody there for that black swan event. If you don't know what a black swan event is, read Talib's book called The Black Swan. Uh, but the unforeseen, foreseeable event, the unexpected and unlikely event that happens from time to time. Uh, well, I had that happen to me. So anyway, I'm home. Uh, get home Tuesday evening. Really nice to be home, be in my own bed. Uh, have the peace and quiet of not having somebody wake me up every hour to take blood or give me a pill or feed me or something of that nature. I mean, just whatever. I mean, you just want to sleep. your body's been through a lot. You've been through what I would probably say, to put it in perspective, is something akin to a severe car crash in terms of skeletal damage that's done, and your body just wants to rest and recuperate. So I'm home. It feels great. Wednesday, I get up, um, fiddle around the house for 2 or 3 hours, take a nap, get up again, and go out for the day. Uh, Go to a coffee shop and kind of do what I was doing before the surgery, and stayed at the coffee shop for a couple of hours. Went back home, had dinner, went to bed at a normal hour. Next day, same kind of thing. So that would be Thursday. Did the same thing on Friday, Saturday, Sunday, Monday. So I've been home now for a week. Got home Tuesday evening. Now it's Monday night. Going to bed. I've had no issues at all. Um, and I forgot to mention, in my mind, prior to the surgery, I anticipated having a suitcase full of pills that I'd be expected to cart around with me and take multiple times a day. And some you take on a full stomach, some you take on an empty stomach, some you took in the morning, some you took at night. I came home with a prescription for 81 milligram aspirin, one baby aspirin a day, half of a blood pressure med per day. Even though I didn't have high blood pressure, they said it's actually protective of the heart and of the kidneys. So they wanted me to be on half. So I got 25 milligram tablets of, I forget what it is, but it's the smallest dose available of this particular blood pressure med. And I have to cut those in half. And Plavix. Uh, that's it, guys. I'm on 3 meds. I'm on those right now. Um, they told me that I would probably drop the blood pressure med after 60 days, and maybe even the Plavix after 60 days. So this type of procedure does not automatically carry uh, a lifetime sentence for, you know, just massive drug consumption. Again, it probably depends on a lot of other underlying issues that you may have. If you're diabetic, you're probably on meds for that. If you have high blood pressure, you're going to be on meds for that, so on and so forth. But post surgery, they are looking primarily at clotting. Uh, uh, they don't want you to have anything that's going to cause a blood clot. Uh, so again, I'm on baby aspirin, Plavix, and half of a dose of blood pressure med, and then at night I take a statin, and I'm on a very minimal dose of statin. I can either take a full dose every other day or a half dose every day. Just take it at night before I go to bed anytime. Doesn't matter if I have fluid on my stomach or not. You couldn't ask for an easier regimen. And it's also, I should point out, everything I've got is generic. These drugs have been around for a long time. We know that they're safe. We know that they're effective. And I think I just had a refill done the other day, and I think, barring exception of the aspirin, which one bottle has 350, doses in it. Uh, I think my cost per month on this other stuff is, if I get 90-day supply, total work. My copay works out to less than $10 a month. So it's actually a very affordable regimen. Just put your mind at ease where that's concerned. But anyway, jumping back into storytelling mode. So I'm back at home. I got home Tuesday evening. I've had a successful week by anybody's measure. There is a caseworker at the hospital who is checking on me typically twice a day. That week, let's see, I came home on Tuesday. That Thursday, I had a telehealth visit with a physician's assistant. We spoke for about 45 minutes, via Zoom. Um, had nothing bad to report. I had kept track of my blood pressure, checking my blood pressure a couple times a day at home. Was monitoring my oxygen levels. They gave me a little finger device, um, and you know, heart rate, things of that nature. Everything was fine. Everything was really excellent uh, all week long. Um, I didn't notice that I was gaining weight, and seems like a pretty mild thing, but I apparently was gaining some weight, but again, did not notice that. Uh, And so Tuesday morning, I got up. This was the week after, 8 days after I was discharged from the hospital, my HK. Uh, Tuesday morning, I got up the usual time, and no complaints at first. As I'm moving around the house, um, everything felt about the same, but I felt like I was a little bit short of breath. Um, and I went back in, was sitting on bed. I was on my bed. I was watching television, and I was almost panting. And I'm just sitting there, and I wasn't really exerting myself. So I thought, well, maybe it's the way I'm sitting, and I'm kind of crunched up. I rearranged the pillows behind me and was sitting up, trying to sit up straighter, and didn't really change things. I was still kind of panting. So I got up to go do something, and I got pretty lightheaded. Well, the PA that I spoke to during the telehealth visit had said, if I had any situations where I felt lightheaded, she said, if possible, go in, check your blood pressure right then, just as quick as you can. We want to see if your blood pressure is dipping, you know, into dangerous territory. But check your blood pressure. So I went in when I felt lightheaded. I rushed back in. I threw on the blood pressure cuff, checked the blood pressure, and it had dropped, but not down to a level that would have caused any concern or alarm. Um, and if your blood pressure drops, it's not so much a question of going too low that makes you feel lightheaded. It's a question of it just being below where your body's used to it being. Um, so, like if you have a history of high blood pressure and your blood pressure is used, normally up here, and they give you meds that it doesn't push you too low, but it brings your blood pressure down to a normal range. That normal range may feel, really unusual for you. You may have some issues with, balance and what have you, dizziness, things of that nature. So when I saw what my blood pressure was after I had that kind of like sinking spell, uh, I, again, I knew what the numbers meant. I knew I wasn't in any danger uh, from the blood pressure. So I'm like, okay, yeah, I'm fine. So I was actually waiting on an Uber at this point in time, and I'd already requested the Uber. I had 2 bags I was taking out of the house with me that day, and I went outside, put one bag down on my front porch, looked at my phone, and it said the Uber was 3 minutes away. So I put my phone down on top of my bag and walked back inside to get my second bag. And the next thing I know, my eyes are open and I'm laying on the floor in my living room. Uh, and I'm like, what am I doing down here? And then I'm like, oh crap, what happened? I mean, I'm not disoriented. I'm fully aware, but I'm fully aware that I don't know how I got down there, and I don't know how long I've been there. So I have a window right where I was laying, and I raised up, and I could see the Uber driver sitting on the street in front of my house. And I had to crawl. I couldn't get up. I had to crawl out to my bag on the front porch, which fortunately was right beside the front door. And I got my phone. I was thinking, you pull in the driveway, I'm having no problem. And so he pulled in the driveway. So I grabbed hold of the railing on my front porch and pulled myself up. And I was standing there bent over just with tunnel vision and stars, and everything was moving. And I mean, just, that for those of you that have never passed out or anything, I mean, there's blackness and there's like burst of light, and it's just, I'm having all that. I mean, I'm having it big time. So I walked back inside to get my other bag, got to the bag, brought it outside, and the Uber driver has pulled in my driveway. He's right up at my front porch. And he's like, are you okay? I said, oh, yeah, I'm fine. And he's like, are you sure you still want to go to the coffee shop? He goes, you look terrible. And I said, now that you mention it, I said, let's go to the ER. So I was conscious. This ER that I mentioned in the first video is brand new. It's been open for roughly 6 months. It's a few miles from my house. And it's on a road that's in a new, massive subdivision. this is basically in the center of the subdivision, and it's not on Google Maps yet. So anyway, I gave him directions uh, on how to get there, and as I'm giving him directions, I said, how long have you been outside? And bear in mind, when I put my phone down, it said he was 3 minutes away. Well, he told me, he goes, I've been waiting for 10 minutes. So that in itself is unusual. For those of you who use Uber, you know that they don't typically wait. They'll give you 5 minutes usually, but after that they leave. But he had waited 10 minutes. So that means he'd been there for 10 minutes. I'd waited on him for 3 minutes while I was passed out. So ultimately, I was unconscious for 13 minutes, completely unconscious for 13 minutes. Um, give him directions to the ER. Uh, you know, I asked him when we got there. He pulled right to the door. Being a new ER, like I said, this is at Wake Med. This is Wake Med's ER in Wendell, North Carolina, which is it's a suburb of Raleigh. Uh, for those of you who are in this area, they know, Wake Med, their main campus ER is like JFK Airport. I mean, it is wide open 24 hours a day, and there's no such thing as walking in there and having, I mean, unless you're having major issues, you're going to wait. The place is always full. You're number 200 in line. Um, this ER that I went to, being brand new, uh, just like the first night that I went there, I was the only patient in the whole building. And this is a substantial ER. As the area out here grows up, they're going to need it. But right now, it's just this big, beautiful building that nobody's using. So this time we get there, it's mid morning. I don't remember exactly what time it was, but 9, 10 o'clock in the morning, something like that. We get there, and I asked him, I said, can you go in and get me a wheelchair? I said, I feel really, really unstable, and I don't want to pass out laying here on the ground. He said, yeah, I'll go in and get one. And I was surprised to look up and see him coming out by himself with this wheelchair. I figured as soon as you go in and say, hey, I've got somebody that needs a wheelchair, I figured they would send somebody out. Well, he gets all the way back to the vehicle with the wheelchair, and a nurse comes out finally, 30 yards away. She comes out of the main door, sees me, and turns around and runs back in. And by the time I got into the wheelchair, I had 6 doctors and nurses surrounding me, and they wheeled me in. Uh, they got me in. They remembered me from, at this point in time, it was basically 2 weeks before. It was actually 15 days before, I think, if you want to be precise, since I'd come in that night. Uh, there were some people on duty then that remembered me from the night I'd come in. Um, and I'm conversing with them. I'm fully awake, fully aware, and they put me, on a gurney, a hospital bed, whatever it was, and they put EKG on me, and they did all the usual stuff you would expect. And I answered their questions. Um, but I told them, I said, yeah, I passed out at home, and I was apparently unconscious for about 13 minutes, give or take. And they said, okay, well, fine. And they came back in a few minutes later. Uh, they said, excuse me. They said, okay, we're going to take you in here and do a CT scan. So they wheeled me into the CT scan room, and the lady asked me, she goes, are you able to stand up? I said, oh, absolutely. Not a problem. Uh, and I just want to stop right here and just say, there are a couple of things I left out. When I woke up on the floor, again, my first thought was, how did I get down here? Because this wasn't a thing where, things just kind of faded out. Something flipped me off like a switch. I mean, I was just gone. I don't remember falling. I don't remember feeling like I was going to pass out, feeling like I was going to fall, or anything. Uh, just completely just there one second, not there the next second. But being aware when I woke up, like, okay, how did I get down here? The next question was, how did I get wet? I just got out of the shower like 45 minutes before this and had on clean clothes. And I'm in, I'm laying there on the floor going, why am I wet? And I mean, like I had on a t-shirt because it was hot that day. I had on a white t-shirt, and it was just, it's like I had been outside in, I mean, it's like I had jumped in the swimming pool. I was that wet, and it smelled terrible. I mean, I honestly, I'm like, did I fall into something? I mean, what is this? It smelled bad. Uh, so I'm at the hospital, and as they're putting the EKGs on me, or the EKG on me, and I'm apologizing. I'm like, look, guys, I don't know why I reek, but I said I smell like a dead animal. I'm like, I don't know what's going on here. Uh, so anyway, they did their stuff. They took me in to the CT room, and the lady said, "Are you able to move? Can you get over onto the scan table by yourself?" I said, "Sure, no problem." So I stand up, sit down on the scan table, turn around, lay down. As soon as I got horizontal, I'm looking at her and I said, "Ma'am, hang on a second." I said, "Can I sit up for just a second?" I said, "I just feel a little funny." And I raised up. I mean, again, I'm physically fine. And I basically I did just a sit up, from just abdominal strength. I did a sit up, and I'm putting up my arms. There's CT machines have this it's about a 9-inch by 9-inch. I think probably it's really called an aiming reticle because it shines the laser beam down on you to make sure that you're centered properly and whatnot. And I reached up and I started using it as a handle. And I thought, wait a minute, that's not a handle. And I had that thought. My hands never touched it. And the next thing I know, um, I've got hands all in my face. There's a mask on me. Um, and I mean, multiple hands, multiple people are around me. And they're like, are you there? Are you there? And I'm like, yeah, I'm fine. They said, we lost you. They said, we lost you there. Are you okay? I said, yeah, I'm fine. Why? What's going on? They said, no, they're like, I mean, and it strikes me as kind of amusing that they are just they're talking to you um, very directly. I mean, they're not holding anything back, but they're also talking to you about fairly complex stuff. When you just, they know what happened to you. I don't know what happened to me, but I fully coded. I didn't have a heartbeat for about 9 minutes, and they had to administer CPR. Um, but I fully coded. Heart stopped completely. And anyway, so this is happening. I'm now back on that gurney, but I'm sitting right beside the CT machine. So once I was awake, they wheeled me back into the other room. And this time, I don't know why they did this time. Probably because I smelled horrible. But the gurney I was on, when I got up this time to get over onto the bed, I mean, there was a half inch of water. I actually questioned whether I had uh, urinated on myself, but I did. This was just coming out of my pores. Uh, and I asked one of the nurses, I'm like, why do I smell so bad? I mean, what is that? And she said, your body is putting out all kinds of chemicals. They said, this is not unusual. This is normal. I've never experienced anything like it, and don't want to experience anything like it again. Uh, but anyway, so they basically got my clothes off, got me into a hospital gown, and they came in with these big ShamWows industrial wipes, and they gave me what passes for a sponge bath these days, and I felt so much better. I mean, I just got that funk off of me, and felt so much better. They and it was, I mean, I guess there's no reason to have somebody sitting there with you, but at that point they said, okay, we're going to let you rest for a minute, and they closed the door and they left me in this fairly large ER examination room, and I sat in there for, I don't know, probably 20, 25 minutes. Um, they're monitoring me from outside. I can see them outside this window, so I know I'm being cared for. I'm being monitored. Uh, But anyway, they came back in and said, we'd like to try the CT scan again. Do you feel up to it? I said, yeah, I feel fine. I said, other than you telling me my heart stopped for almost 10 minutes, I felt fine the whole time I've been here. So anyway, they take me back in. This time I had no problem getting off the gurney onto the CT table. The scan, once they get you on the table, uh, took less than a minute. It's no big deal. Again, if you've never had one of these scans, some people find an MRI to be very scary, not because there's any pain involved, but because they're extremely loud. If you've never had an MRI, it's like putting your head in a metal trash can and having people hit it with metal baseball bats. Uh, CT scans are completely quiet. They don't make any sound at all, except for a mild whirring sound like a small desk fan. And again, there's no pain or anything. So I was in there for less than a minute. It's not claustrophobic like an MRI is either. The whole CT scan machine is only about, I don't know, maybe 20 inches thick. So you're never in this tube where you feel like you can't get out of it. It's not claustrophobic or anything. So anyway, they got me out of there. Did the scan, got me out. I got back over onto the bed. They wheeled me back in the other room. Um, and about 20 minutes later, they came in and said, we're transferring you down to the main campus again. Um, and it's going to be lights and sirens. That was their terminology. They said, yeah, we need to get you down there as quickly as we possibly can. Again, I felt fine. I understand the gravity of what they're telling me. Uh, but I've told you everything they told me. I mean, I just know by their language that this is something serious. So anyway, get in the back of the ambulance. I'm on a gurney. They put me in the back of the ambulance. Someone sat back with me, which I think is normal for anything. If you had a broken thumb, they'd sit with you. But this guy was going out of his way to maintain conversation with me. I think, in hindsight, he was trying to really make sure that I was conscious and that I was functioning. And because he talked to me the whole time, it's about a 15-minute ride down there, maybe a little bit less because they were going pretty fast. Uh, but anyway, got me to the uh, uh, ER at the main campus. Did not go into the ER. They actually wheeled me directly into surgery. And the surgeon that had done my surgery the week before was there. Uh, and I'm talking to them as they're wheeling me in. I'm like, what's going on? They said, well, what they told me this time was they said, well, you've got what's called a pericardial tamponade, which means that I had fluid that was accumulating around my heart, and it was keeping my heart from beating. So my heart was, fluttering as opposed to having true productive beats. And they explained, yeah, you coded. They lost you for over 9 minutes at the ER. We got to get you in here. We got to fix this right away, like right now. And he told me, he says, it's going to be, we're going to have you fixed up here in not too long. But I said, okay. I'm like, I'm good. I said, just out of curiosity, are these the same people that operated on me last week? And I mean, I'm in a room. It's not like something you see on TV. This is a pretty boring room that just had, I don't know how to describe it. It didn't look like it did not look like a surgical theater that you would see on a TV show. Put it that way. But several people answered me and said, "Yeah, we're the same team, man. Sorry to see you back. We're the same team." I said, "Well, do a better job this time." I'm like, "Come on, what have you done to me here?" They said, "No, this wasn't on us." I said, "Okay, well, I understand. It's not a problem." Uh, and I said, this is really twisted, but I said, I don't remember anything after the anesthesiologist came and saw me in pre-op last week. I mean, the entire process was completely, I mean, it's just, there's no memory there of it at all. I said, when I came in here last week, was I conscious? And they're like, oh yeah, you were fine. You didn't have anything before you came in here. You weren't anxious or anything, so we didn't give you anything to calm you down. So you were talking to us. I'm like, that's wild. I had told him, I said, I have no memory of that. So anyway, they moved me over onto the surgical table. They you know, they taped down loosely, but they taped my arms down so they could do what they had to do. I mean, there were some uh, IVs involved and things of that nature. I don't know what it was, but there was a large device. I mean, I'll say it may have been some kind of X-ray machine or fluoroscope machine. I don't know, but there was this large device that was basically right at maybe 2 inches above my chest, uh, and they were. I had two people on each side of me working on me. At this point, a nurse starts. I'm still wearing like gym shorts, and this nurse, she just grabs some of my shorts and she just pulls them. I mean, just underwear and everything, just pulls right off. Uh, that is one thing. I mean, trust me, if you're modest before you go in for surgery like this, you won't be when you come out. I mean, there's just no point in modesty anymore. I'd walk buck naked down the center of Main Street at lunchtime. Just don't care. Uh, But yeah, I mean, these people are professional. Uh, they're about getting it done. I mean, they just flat out get it done. And but I'm talking to them while all this is going on. I'm fully conscious that they've given me nothing at this point. And but anyway, so one of the people tells me, says, okay, we're going to put this mask on you. And they put a mask on me. And I said, what is this? They said, well, this is just getting you prepped for what's to come. I said, okay. So they gave me this mask, and what was in there, I don't know, but it did. I mean, I was fully aware. I'm still talking to them, and it didn't do anything to me. I wasn't talking loopy. I wasn't. I mean, I was fully conscious, fully in control. Uh, so whatever it did, I mean, I really didn't detect anything. And then I was on that for a couple of minutes, maybe. Yeah, probably a couple of minutes. And then they brought in another mask and they put that on me. And that mask, I could feel a little something, but again, I wasn't loopy. I wasn't getting like I've seen people, it's not like you're on nitrous and you're laughing about stuff and just talking crazy, like, oh, there's my dog, or no, it wasn't. I was fully aware, fully conscious, in control. But this one, I was feeling a little something, just something very slight. And then, because I'd asked the guy, I said, at some point, am I supposed to start counting backwards from 100 or something? And he goes, "Nah, we don't usually really do that." But he goes, "You can if you want to." I said, "Okay, well, we'll see." So then they bring in the third mask, and he goes, "Now this one you're going to feel." And it was on me for about 4 or 5 seconds, and I said, "Oh yeah." I said, "I feel this one." I said, "I don't need to count backwards." I said, "It's time to say night." And I raised my hand, and I'm like, "Night, night." Last thing I remember, I was gone. Well, but I wasn't gone from anesthesia. I coded again. Uh, this time they told me no heartbeat for about 6 minutes. Uh, but they did what they had to do. They opened me up to the extent they had to open me up again. And they got that fluid out of me. And honestly, they told me how much they got. I want to say, they give you everything in milliliters and whatnot. And I remember at the time that I kind of did the equation, and it was a little bit over a quart. It was like something like 34 ounces. Uh, so, my chest cavity around my heart had filled up with fluid. Uh, and I had not noticed. Uh, okay, but anyway, let me just, before I get sidetracked, let me just say, so I'm telling him, well, night, night, and I'm gone. But I fully coded again. That was what caused me to go so abruptly. Next thing I know, I woke up in uh, post-operative intensive care. And again, this time I was fully aware. I was less aware this time than I was the first time, but there wasn't a big difference. Um, I wasn't groggy. I wasn't, but I just wasn't 100% there right away. But again, the first thing I saw was the clock on the wall, and I was able to do the math in my head that I'd been under for about a little over 2 hours, about 2 hours and 15 minutes, and uh, there was somebody in there with me just as soon as I opened my eyes, and they're like, "Are you okay?" And that's when they told me I'd coded again, just as they were putting me under. And so yeah, I'm fine. And I was all there and everything. And the doctor, uh, a doctor again, I don't think it was a surgeon who came to see me at that point. I think it was a cardiologist, but they came in right away, and they're like, you're a very lucky person. They said, uh, you have had your heart stopped twice today, uh, for extended periods of time, and had you not been where you were at those particular points in time, you wouldn't be here. So if that Uber driver had not waited kind of an excessive period of time, uh, I would probably not have made it to the ER. Had that Uber driver not suggested that we go to the hospital as opposed to just taking me and dropping me off at a coffee shop, I probably would have died in that coffee shop. There's a really, really good chance I would have died in that coffee shop. And had they not moved me as rapidly as they did down to the surgery center, again, there's a decent chance that I would have died potentially in the ER. I don't know, or in transit, or I mean, there were just multiple opportunities that day over a very short period of time for things to go horribly wrong from my perspective. And fortunately, again, had great people, highly trained individuals who were able to operate under pressure and, and get me back up and running again. So anyway, so this happened. This happened on a Tuesday. Uh, Again, 8 days after I was initially sent home after the triple bypass cabbage operation, cabbage procedure. The periocardio tamponade, I think I'm saying that right, or cardio tamponade, uh, is a known potential complication. They say it impacts about 5% of the people that have open heart surgery. Uh, 95% chance then that it's not going to happen to you. But the possibility that it might happen to you is why I say, and going back to point number one in this video, you absolutely positively must have somebody with you at your home. I would recommend minimally 7 days. Um, and someone now for those of you who have done the math, you'd say, well, that what would 7 days mean? Because this happened on your eighth day. Um, it's likely that a person who is observant would have noticed changes in me that I did not notice in myself in those 7 days. Change, and I think I started mentioning this earlier and I stopped. Change number one being I gained 26 pounds, I think they told me, 24, 26, something like that. But I gained about 26 pounds in that week from fluid. And I had noticed that my ankles were swollen and my hands were kind of swollen. But I didn't think anything of it, and I didn't mention it to the nurses that I spoke to, the nurses or the PAs I spoke to, because they checked on me every day, either over the phone or via a Zoom call. And I just never brought it up because I didn't think any. I just didn't think anything of it. I didn't really. I wasn't really paying attention. I knew I was swelling, but I didn't know that was a sign of complications or anything. But somebody who was there with me would have probably looked at me and said, "Man, you're blowing up like a balloon. What's going on here?" But anyway, having that person there in the house with you, again, will make your life much easier. They can make you a bowl of soup. They can fix you a sandwich. You don't need to have a gourmet chef, but somebody that can just make lunch for you and hand you a sandwich, because you're just beat, you're exhausted. So you need somebody there. And just in case you decide you're going to pass out on the way to the coffee shop on your eighth day, having somebody there that can go, yeah, this is not normal. We need to get you back to the ER. Uh, Having that person there with you to make that call um, is potentially life saving. And if you have to pay, your next door high school kid, I don't know what you pay him, $50 a day or whatever, but say, hey, I'll give you $50 a day, order all the pizza and pasta you want from Domino's, go crazy on Netflix on my big screen, bring your Xbox over, do whatever, but you just need somebody in the house with you day and night. I would say for minimally 7 days, uh, just because of possibility of problems. Uh, After 7 days, you're probably free and clear for the most part. Uh, if problems have not surfaced by then, it's unlikely they're going to. But anyway, that was the exciting second chapter in this whole thing. Uh, and I'll give you the third chapter now. You don't have to wait for a third video. But anyway, so I this time they actually kept me in post-operative and intensive care longer than they did the first time. The first time they had me into a regular intensive care room the morning of the second day. Uh, I'm sorry, the morning of what they would call first day post-op. I had the first time I had surgery on Friday, and the next morning they sent me down to traditional intensive care. This time they kept me in uh, post-op intensive care uh, for 2 days, or into the second day post-op. Uh, Care was exceptional. Uh, I mean, I basically didn't have to lift a finger. Uh, if I needed somebody, that there was somebody right outside who could see me the whole time, and they checked on me constantly. Uh, everything went as well as it could go. Uh, there are some things that I'm reluctant to even talk about. I mean, not many things, just a couple, and it boils down to uh, being able to take good advice and take instruction when that instruction is given by people who know what they're doing, but also knowing yourself well enough to say no to some of those things. And just, without going into way too much detail, uh, uh, they have this sonogram, yes, sonogram, I believe it is, ultrasonic, scanning device, and they're obsessed with you going to the bathroom, both number one and number two. So in terms of number one, so to speak, excuse me, uh, I have a large bladder. I mean, I just don't have a big guy. I have a large bladder. Uh, so I would go to the bathroom normally for me, no issues whatsoever. And then invariably they would come in to check on me 2 hours later, and they'd go, "Oh, and they'd use a sonogram. They're like, you have 150 milliliters of urine in your bladder. You're not emptying your bladder." I'm like, "Yeah, I am." And like, "Well, no." They're like, you should feel a sense of urgency that you need to go to the bathroom right now." And I'm thinking, no. I mean, 150 milliliters is nothing. It's a relatively small percentage of my bladder capacity. And I'm one of these people. Not again, not trying to go TMI on you here, but I get up in the morning and go. I maybe go at lunchtime, might go again at dinner time, and once again before I go to bed. That's normal for me, and I'm drinking, water, Diet Mountain Dew, uh, iced tea. I'm drinking something pretty much all the time. I've got coffee and Diet Mountain Dew sitting here with me right now. I mean, my fluid intake is substantial, but my bladder capacity matches my fluid intake. So, but they just wouldn't let it go, and they 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 decided they were going to put a catheter because they said, "Yeah, you're not draining this last part." I'm like, "I am. I mean, I know my own body. I'm fine." And they're like, "Oh, you're declining?" And I said, "Well, I'm not declining so much as I'm saying it's not necessary. I know what I'm talking about. I'm going to the bathroom on a regular basis while I'm here. Um, I would prefer not to have a catheter. I had a Foley catheter during the first surgery. They didn't put one in before the second surgery. Uh, And I'm like, guys, I don't need it. Well, at that point, this nurse goes out and comes back about 10 minutes later with like the nurse manager or the charge nurse for the floor, who very sternly is like, well, you better do this, or because I'm not telling you you have to, but if you don't do this now, you're going to do a Foley in the morning and blah blah blah, and it's going to be worse. And I reluctantly said yes. I regret that. Okay. I don't have my calendar app open, so I can't tell you exactly what we're talking about here in terms of time, but roughly 1 month. Is that right? Yeah, it's been roughly a month since they did that catheter to me. This was just a temporary catheter. It was not a Foley. I mean, so they got it in, got it out. But the only pain I've had out of this whole process was the that catheterization that they did to me. The first nurse was not able to get it done. She went and got a second nurse who was not very skilled, but she was determined. And I'm having pain to this day. I have a follow-up doctor's appointment this coming Tuesday, and that's the number one thing on my list to talk to them about. That I don't know what they did, but something's not 100% right. I mean, I'm not dying in pain, but I'm having pain from that catheterization that I shouldn't be having. I didn't have any pain after the first surgery, and I had a Foley in me for 4 days. Uh, so yeah, something wasn't done properly. And had I been more assertive and just said, no, I mean, you're not giving me a catheter now, and you're not giving me a Foley in the morning, because I knew my body was functioning properly. I mean, I'm not hopeful. If I need a catheter, I want the catheter, but I knew I didn't need it, and I shouldn't have acquiesced to their kind of stern demands that I get one. Uh, but I don't know really if there's a point I was trying to make here. But if you're physically and mentally competent and you're able to, uh, if you are self-aware to the point where you can tell them, no, this is I'm going to the bathroom in a way that's normal for me, or I'm doing whatever it is I'm doing. I'm doing it in a way that's normal for me. Um, Question them. As good as they are, they still make mistakes. So do not hesitate to question your caregivers. Ask them why they feel this is the best course of action. Evaluate what they tell you. Um, in a situation like this, waiting until the next morning when I had another opportunity to empty my bladder, uh, there would have been no harm done in waiting another 6 hours or so. Um, But like I said, they were very determined that they were going to get this catheter done, and I gave in to their demands, and I regret it. I mean, I don't think there's any lasting damage done, but the only discomfort I've had from uh, from having two open heart procedures in the space of 11 days uh, has been from this catheter. Seriously, I mean, the only significant pain I've had. I will say though that in the process, when I coded the first time, uh, on that Tuesday morning, uh, on my return trip to the ER, when I coded, uh, they probably, I was surprised when they told me to give me CPR because, again, understand, my chest had just been wired closed. Two sides of my sternum were wired shut, uh, 8 days prior. And I was, or I guess it was more than 8 days, it was like 12 days prior. Uh, but anyway, I was impressed because I mean the first thing I did when they told me to give me CPR was I looked down to see if I had any bleeding or any sign of damage, and I didn't. Uh, so apparently, the stainless steel wire they used to pull your chest cavity closed is pretty substantial uh, and pretty durable. But either in the hospital when they gave me CPR or when I fell in my living room, uh, there was something in my living room, a couple of things, one of which I think I fell onto. It's kind of funny. I won't even go into what it was, but it was a large, solid object. But I broke a couple of ribs. And again, I'm not pointing fingers. I don't care if it happened to their during the CPR. If a couple of broken ribs is the price I pay for being alive, I'm happy to pay that price. But the only pain I've had throughout this whole process has been the ribs and the catheter. Uh, the ribs can't help it, and the catheter, I shouldn't have done it. I shouldn't have let them do it. Uh, but anyway, I probably have rambled on enough. Uh, you know, I just wanted to make a video giving my personal experience. I'll probably watch this video. I'll be the only one who watches this because I want to, 5 years from now, I want to remember, kind of what I went through here. This has been an interesting process for me. It's one I'm really grateful that I have come out of uh, as well off as I have. My prognosis for the future is excellent. Uh, at this point in time, most of the soft tissue is almost 100% healed. Again, I'm looking at probably another three weeks or so before, statistically speaking, my bones, my sternum should be fully healed, and I can do anything I want to again. Uh, my weight has come down, not certainly not from lack of eating, but my weight has come down since I left the hospital because I was probably tending to retain fluid even before the first surgery. And then after the first surgery, like I said, I gained something like 24 to 26 pounds in a week, which was all fluid, and that's come off me now. So I'm about 10 pounds lighter right now than I was when I went in for the first surgery on the first day. And my weight is trending down. I weigh every morning and it is trending down. I feel great. Uh, Probably my biggest danger is the danger I am to myself because I feel like I can do anything. But again, I still need to exercise some caution in activities I might participate in. Uh, but I've got some of these, uh, slam balls that are like dead weight basketballs that you pick up and you throw down for exercise. And I've been looking at those the last couple of days thinking, man, I'd really like to go out here and work out with those for about 10 minutes. But I don't think I should at this point in time, but I could, but I don't think I should. I think I'd be taking a little bit of a risk. But yeah, I'm feeling good. I'm walking a lot. Uh, Again, no pain. I have not had uh, anything other than Tylenol since I left the hospital, either the first time or the second time. Oh, and I left out. I knew there was a chapter 3, and I completely left it out. So I'm going to jump back. So after the second surgery, when they moved me back to the standard cardiac intensive care unit, uh, my nurse that morning, I told her as soon as they got me back in there, she came in to see me, and I said, I got to tell you something. I said, I think I have COVID. And she goes, no, you don't have COVID. I said, I really think I do. I said, the last 12 hours, I've been going through like 2-hour swings between burning up and freezing to death. I know I don't have a fever. You're taking my temperature every hour. So I know I don't have a fever, but I think I've got COVID. She goes, nah, you're fine. So that evening, I told her this about 9 o'clock in the morning. That evening at shift change, when my new nurse came in at 7 p.m., I told her the same thing. And she goes, I'll get a test kit. So she went and got a test kit, came back. 30 minutes later, comes back to the room wearing a spacesuit. I had COVID. Unbeknownst to me, while I was in there, or that between the time I went in for the open heart surgery and the time I came back for more open heart surgery, uh, COVID had really flared up in this area in Raleigh. And the hospital was full of COVID patients. And in fact, once I tested positive for COVID, my nurses all came in and said, yeah, my husband's got it at home, my kids have it at home, uh, whatever. But this led to some unintended consequences. I'll be completely honest with you, and I know this makes me a horrible human being for saying this. If I had known then what I know now, I never would have told them that I had COVID or that I thought I had COVID. I never would have wanted to be tested because they said, okay, we're going to move you to an isolation room here in the next hour or so. And then they came back in about an hour later and said, well, we're not moving you to an isolation room. We don't have any isolation rooms available in the whole hospital because we're full of COVID patients. So they brought in an industrial HEPA filter, which is used a lot of times in houses where there's been water damage or whatever, because it can filter out, well, HEPA filters can filter out virus-sized particles. But this thing, I mean, it's the size of, I don't know how to describe it. It's like a portable electric generator. It's a big thing. It's a big piece of machinery, and they are very loud. So they put that in my room, plugged it in, and proceeded to tape my door shut. So this thing is this it's like having a lawnmower running in your room. So this was on when was this? This would have been Wednesday evening. Is that right? Tuesday. Might have been Thursday evening when they put this in my room. I believe that's right. It would have been Thursday evening anyway. So they put this thing in my room Thursday evening about 8 p.m. and it ran continuously until the following Thursday when they released me from the hospital. So for 8 days, I listened to this thing. Like I said, it's like a gas-powered lawnmower running 4 feet away from your bed. You couldn't watch the television because you couldn't hear the television. You couldn't take phone calls because nobody could hear you. Um, they came in my, now the one good thing is they only came to my room about once every 4 hours at this point, as opposed to once every 15 or 20 minutes. So I was able to sleep. As strange as it sounds, your brain can tune out stuff eventually. So I was able to get some sleep and some rest. Not great rest, but better than just being constantly awakened every 15 minutes to every half hour. Uh, but yeah, I was ready to jump out a window. By the time they let me go home, I was ready to just take a flyer out of my window. Um, and I joked with them. I said, hey, if I were in uniform and I was a prisoner of war, this would be a violation of the Geneva Convention to put me in a situation like this. This is horrible. Uh, Fortunately, I'm kind of a loner by nature, so not having any contact with people wasn't that bad. I guess that's why I live by myself. But with that said, uh, that week was miserable. I mean, that was rough. Uh, but anyway, uh, last thing I want to say is just to reiterate: if you think you're having a heart attack, if you're having any kind of unusual sensation, don't wait till you're really manifesting everything you've read about in terms of heart attack symptoms. Uh, get yourself to an emergency room. Um, put your trust in the professionals; they're going to take care of you. If you have an issue, your chances of survival are better if you have it in the ER as opposed to have it at home by yourself or with your wife or husband standing there. Having a room full of medical professionals who are trained in how to deal with you just puts you in a far better situation than uh, you have at home. So better safe than sorry. Trust in the procedure, trust in the process. Know that your chances of having a positive outcome are very, very good. Don't be afraid of it. I mean, I know it may be hard not to be afraid of it, but don't be. It's one of these things that you may not like it, but you need it, and it will extend your life. Um, and one of the things I talked to another patient about uh, while I was immediately after my first surgery, uh, when I was in there, just starting to walk around and stuff. Uh, he had not had his surgery yet, and I just told him, I said, look, if you're a control freak or if you're just somebody who and I'm a control freak. I got to admit, I'm fortunate because, like I said, I had a couple of years to maybe think about where my particular circumstances might be leading me. So I'd done a lot of research. I looked into maybe what to expect, and I felt like I knew more than the average person going in, maybe what potential there was in all this. Uh, but if you don't have any indication that you have an issue, and you find yourself in the ER, and then you find yourself a few hours later being told that, hey, you're scheduled for surgery maybe today, maybe 3 days from now. But as soon as they can get you in there, there's no point putting it off. They're going to get you in quickly. So again, I'm at one of the busiest cardiac care hospitals in the country. Uh, you may be at one that's not as busy, and what for me was a 5 day wait for my surgery might be a 1 day wait for you. Uh, and and to absorb the information that they give you uh, would be almost overpowering. I mean, just overwhelming for almost anybody. I felt like I was on the verge of just saturation on several occasions. Like I said, I already had a couple of years to absorb some of this and recognize the potential for this happening, and I had researched it. So there were a lot of things that they were telling me that I could almost anticipate what they were going to say. But with that said, I mean, the Thursday before my first surgery, I had probably eight or nine different groups of people come in to explain things to me from their perspective, and explain what their part of the process was. And it was as daunting as it was uh, just really an amazing process to watch, and to be a part of. But when I say be a part of the process, if you approach with the wrong mindset, you're going to feel like a cow that's in a slaughterhouse. You're part of the process, but you have no control over it, uh, and and you don't. But in this case, you're going to come out the other side of the slaughterhouse in better shape than you were when you went in. The cow can't say that. So again, put some faith in the system, put some faith in the training that these individuals have. Uh, there's a standard of care, and certainly, like I said, in the Western world, um, you're going to get that standard of care at any reasonable hospital. You'd have to really go far. I mean, you'd have to really search for a hospital that couldn't maintain the level of care that I experienced, and that level of care is going to get you to a positive place. So, you know, if you have to, put your fingers in your ears, just tell them you don't want to hear anymore, just get this over with, and just get it done. But don't let them talk you into a state of anxiety or a state of fear or panic. Um, and don't let them talk you into this idea that you're going to have just unbelievable pain when you come out, because you may not. You may get lucky like I did and not have any pain at all. My research has indicated, my post-operative research indicated that people that have valve replacements, they seem to have more pain than people that have just this cabbage, this triple bypass. Uh, that may or may not be true. That's just kind of initially what I found, hearing testimonials from people that have had aortic valve replacement. So, and I hope I said that right, aortic valve replacement, but heart valve replacement seems to be more painful post-operative than cabbage. Uh, but anyway, but don't let them scare you or intimidate you. Um, just know that you're on the right path, and that you're dealing with good people that have your best interests at heart. Um, I probably I've taken so long to make this video just because honestly, when I think about the people who care for me, I feel like tears welling up my eyes because I'm just so grateful for them. Uh, they did an amazing job, and got an amazing bill, by the way. We won't even talk about that. But got a bill with several commas in it, and well, not several, but one comma and a decimal point. That's enough. Uh, but there were a bunch of numbers there, and but anyway, it is what it is. What's your life worth? Again, with my family history, or I should say, in some ways, lack of family history, because I don't have a family history of heart disease. And again, I don't have personal history of things that would be problematic, or make my recovery more challenging. Um, I'm looking at, hopefully I've added 20 years to my life. Most of my family uh, has lived to be has lived well into their 80s. Um, you can't count on anything. I can't count on tomorrow, but I know that I'm going to tomorrow healthier and in a better shape physically than I was 30 days ago. So anyway, guys, that's it. I mean, I'm kind of babbling at this point in time. Uh, just want to give you positive motivation to the greatest extent possible. I hope that this has been useful. I've tried to cover all the little minute things that happen in the hospital that might throw people. Again, I apologize for this being wordy and long and just maybe overly detailed. Uh, but if I have covered uh, something that you won't have questions about, uh, put in the comments section down below, and I'll respond to your questions. I'm an open book on this. More than happy to discuss it with you in any way, shape, or form. Uh, but I'll leave it there. Hope you enjoyed chapter 2 of this story. It definitely took a turn that I wasn't expecting it to take. Uh, it's probably not going to happen to you if you have open heart surgery. Like I said, I was a 5%er here. I was one of that unlucky 5% that had a major complication, and pretty much what they tell me about as major a complication as you're likely to see. But things worked out in my favor. I was in the right place at the right time and came through it. And just looking forward to the next 20 years. But again, have any questions? Put them in the comment section down below. Uh, if this helps you, I'm not looking to grow my channel, but if this helps you, if you give it a thumbs up, it will the algorithm will steer other people that are looking for information on this topic to this video, and maybe it will help somebody else. But I appreciate all of you for listening. Again, I know I took up a lot of your time, but y'all take care.